Let's call the Finance Committee budget hearing meeting.
Yeah. Turn off the audio on the devices.
Oh my God.
Okay, I'm back. Now we're ready.
Can we have some milk too, Fred?
Say what? No, water.
All right, we got
You
Chief
are-
Herman coming on now. I do want to just remind everyone that if you're watching anything, if you're watching this also on another platform, that it does create a little bit of feedback. We've been hearing it the last few meetings. I don't know if anyone is, but we just want to, if you are, to please either mute it or bring it down or turn that device off. So I know like Granicus would do it, I believe, or if you're looking at a stream. All right, let's see Chief Herman's here.
Can I ask a question to Kia?
Sure.
Did we get minutes for yesterday? I got the notes from yesterday, and I guess they were finance department handouts. Did you send something else?
No, the minutes are attached to the agenda. I did them last night.
Okay.
All right. First, we can't see Fred because he's not lit, and now we can't see Fred because he's not there. Are we ready to go? I'd like to
Lights
call
on.
Finance
Okay.
Committee budget hearing for April 16th.
Hold on one
Order.
second. Hold on one second.
Mark, you want to cut me down, Mark?
No, we're live on.
Now you really get to see
Okay.
Fred.
On stream?
Yes.
So now we're good.
All right. Want to call the Finance Committee budget hearing meeting for April 16th to order. All members are present and accounted for. First item before the committee is approval of minutes, but I don't. Here we go. So minutes from Wednesday, April 15th for the 1 p.m. session.
Move approval.
Second.
Any discussion? All in favor signify by saying aye.
Aye.
The ayes have it.
Does the Kia hand up?
Yes.
Kia?
Did you approve the agenda?
Yes, we did. You just didn't hear it. I move approval of the agenda.
So moved.
Second, Fred.
Okay, second.
Any discussion? All in favor of approving the agenda, please signify by saying aye.
Aye.
Aye. I think there was a notion to, well, let's see. Do we have police here? I see Paul Herman's name, but why
Yes,
don't
I'm here. The video should be working.
Okay.
It's just me.
Okay.
Come here. Yeah. Let me grab my stuff from the office and then sorry, we're moving to a conference room.
Sheila, did you want to go? Let's go ahead and start with fire since they're ready and we have a PowerPoint from them.
That would be fine. Did police send their presentation to Julian?
We don't have anything.
They have.
Does not seem so.
No.
All right. Chief Romali, do you want to, and also welcome Deputy Chief Spriggs. Do you want to start your presentation?
Sure. We appreciate the time to present our budget to you. What I do want to say is Chief Spriggs and I personally want to make sure that everybody out there knows we are very proud of the men and women of the Annapolis Fire Department. We believe that they have really stepped up in this time of the pandemic. They are coming to work every day. They're going out here and handling all the emergency calls that they receive. And we are not getting any membership. They are stepping up and they're really doing their job. And we're very proud of that. We're proud of what they're doing. And I just wanted to make sure I put that out there in the public.
We also appreciate that, Chief. We were talking about a little bit before we came online, and you really are on the front line. And I think we appreciate all of the people on front line, all the health workers, even the grocery store, but especially our public safety people. So I think everybody on the committee, everybody, period, should be thankful for that.
Yeah, we appreciate it. Thanks.
Okay, you have provided us with a PowerPoint. We appreciate that, and I think we're ready to hear it.
Okay, so I'm sure he's going to pull it off, but the Annapolis Fire Department exists to provide a safe environment to our community by minimizing the impact of fire and injury through public education, quality services, emergency preparedness, and overall safety culture in the department. The next slide is just an organizational chart, a very basic organizational chart, which shows that the fire department's just broken down into 2 areas, operations and administration. On the next slide, you'll see that the Annapolis Fire Department is an ISO Class 1 fire department. The Insurance Services Organization, which is an independent agency, provides ratings for insurance underwriters. Their classifications are rating from 1 to 10, 1 being the best and 10 being very little fire protection at all. I'm proud to say that we still maintain a Class 1 ISO rating. A lot of things are factored into it. I know you listened to Marcia yesterday in Public Works, but the city's water supply is a big part of it. They did tell you yesterday, and we're glad to hear that they're continuing to do it. They're out there inspecting the fire hydrants and testing the fire hydrants every year. It also goes into the fire apparatus, the engine companies, the truck companies. We have deployment, staffing. We do get credit for dispatching. Our dispatching is done through the county, but there are dispatching. The dispatching system is top notch, and we get a lot of points for that. It also goes into our community risk reduction, which are our prevention programs and our fire investigation programs that are out there. So we are one of only 2 ISO Class 1 departments in the state of Maryland. Our firefighters on the next slide are represented by the International Association of Firefighters, Local 1966, which is the Annapolis Professional Firefighters. That is the labor organization that represents our firefighters and our lieutenants. We have a very good working partnership and relationship with them to support the mission of the fire department. We're proud of everything that they do. We do have volunteer fire companies in the city of Annapolis. There are 3 companies: the Eastport Volunteer Fire Company, Independent Fire Company, and Rescue Hose Company, which is on the next slide. The city owns all the fire stations. However, the volunteers provide a very important support operations to the citizens of Annapolis, to our department. The Eastport Volunteer Fire Company actually saved the city a lot of money. They own 2 fire engines, currently own a ladder truck, 2 medic units. They have 2 special support or special events gates that we operate, and a pickup truck that's got no plow in it. So while they purchase those units through community donations, it's staffed by members of the Annapolis Fire Department. The Independent Fire Company is similar. They own a pickup truck with no plow. They also own a small rescue boat that we utilize on a regular basis. They're converting that pickup truck into a water vehicle to carry more equipment with water operations. The Rescue Hose Company still has some active members, one of which is the Annapolis Fire Department's official photographer that's out there. The next slide just gives you a slight overview of the proposed budget that's out there. We have just over $20 million proposed budget, which includes our overtime costs. We're authorized strength 122 people. That is 106 uniform and 6 civilian staff. And as we go through it, we will quickly learn that 94% of our budget is all salaries. So there's very little operating budget that's involved in it. But we operate out of 3.5 fire stations, and everybody likes that 0.5 fire stations. But the city owns the Eastport Station, the Falls Drive Station, and Taylor Avenue Station. We share the Annapolis Neck Station with the Anne Arundel County because that's right on the city county line on the Annapolis Neck Peninsula, and it is a very good relationship and partnership we have with them at that station. Next 2 bullets, I'd like to publicize the whole lot because under my watch, I'd prefer not to have either one of them. But our last fire death in the city of Annapolis was in 2010, and our last line of duty death was in 1964. So we hope to continue that trend. On the next page, just gives you the services that we provide, and that's, as I earlier talked about, the men and women in the Annapolis Fire Department. What makes our department so great, we're sort of too small to be big and too big to be small type of organization, but because they wear so many hats and they do so much cross training, that they can provide all these resources to the city of Annapolis, our visitors, and our community partner in the county. And it's emergency medical service, fire rescue services. We actually do hazmat, technical rescue, marine operations. We operate a fireboat plus the small boat out of the Taylor station. So we do some swift water operations also. We're part of the county dive team. We have fire and explosive services unit. We provide code enforcement, public education, tactical medics, which supports the police department's SWAT team. So we're very proud with our numbers of all the services that we can provide with the budget that we have.
What is
The next
bike
one-
medic? You do,
I'm sorry?
bike medics? What?
The bike medics are just they're paramedics that ride on bicycles during special events.
Okay.
St. Patty's Day Parade would be one of them.
I was afraid you were going to.
Get through the starts. They're just a special events unit. They are typically, it's an overtime assignment, but it's just so we can get around some of the areas. We also use them in the lower end of Eastport, like 4th of July. It's all special events.
Okay. I was afraid you were going to tell me you fix bikes. Jeez.
No. Well, we do fix our own bicycles, but that's that's it. The next page is our minimum daily staffing. Get that question all the time, or how many firefighters and paramedics on duty every day. This is the very minimum amount that we have to have working every day to provide the service. And that's 23 people. So there's 23 people in operations every single day, day in and day out. What's important to note is that as we go through this, you'll see one of our goals is to increase our minimum staffing to 25. We know that's difficult to do with the budget situation, but that is definitely where the city needs to be. And if you look at the Eastport station there, we have 6 people working in that station every day. And that's 2 people in the medic unit, which we keep independently staffed now. We've changed that. They used to cross-staff that with the ladder truck, but the need for the medic unit and hospital wait times pushed us to make that change. The crew over there, the 4-person crew, they take either the fire engine, ladder truck, or the boat out, depending on what the call is. And they can't get 2 pieces out. We go through our presentation, show you how important that is at times. But that's the important note that we do with daily staffing. Taylor Avenue Station also cross-staffed. They were cross-staffed rescue squad and our hazmat team out of that station. And then the medics at 48, because that's the Annapolis Next Station, they're part of the dive team. Yes, ma'am.
Chief, how many are staffed for the Annapolis Next Station at any given time?
So we have 3 people from the city of Annapolis in that station. We have 3 county stations. So the county runs the fire engine out of the station. We run the medic unit and the EMS supervisor.
So 6 people.
There's 6 in the station, 3 of them in the cities, 3 of them in the county.
Okay. All right. Thank you.
We can go to the next slide. This was our total responses for last year. We ran over 12,000 calls for service. And as you see, the majority of what we do still relates to emergency medical services. So that's picking up 600 people and taking the, but that's the breakdown there of what we do. Fires actually are staying pretty consistent there. It's just the next biggest part of what we do.
Chief,
Yes, sir.
that seems like a bigger fire number than I remember from the past. That's a lot of fires. Can you give us more detail on the nature of all of those? That's almost
Actually,
3,400 fires.
The fire responses are higher than they used to be. Unfortunately, we've seen that whole cycle where you go from having a low amount of fire. It always seems to come in cycles, but some of it also is relates to how we're doing our reporting. Our reporting before used to be done by dispatch codes. Now we actually go by what the officers put on the reports and the categories that's done by the National Fire reporting system. So that it all comes from the reports that are driven. But yeah, we would agree that it does seem that our fire responses are higher.
But let me see if I understand. This is actually a more accurate account than we were getting in the past. In the past, I think it was more like 1,900 calls for service or something that was half of this. This is certainly we don't want that number to be big, but it does mean that we have a lot more calls for fire than I had been thinking.
Previously, yes. I would say this is more accurate reporting than we had in the past. All the reporting in the past was from the dispatch code. When our dispatchers get a call, they threw it in that category, and it didn't necessarily mean that was the correct category. Once they did the fire report or the incident report, which category these things fall into.
Thank you.
Sure. Our next page will just tell you a little bit about our EMS transports. We transported over 5,600 people to the hospital last year. Our EMS billing collected $1.7 million. It's been pretty consistent. And for the members of our department, they logged more than 37,000 training hours. Fire loss, and this fire loss was in the city of Annapolis, was $2.7 million last year.
On the ambulance, are we getting resolved the length of time that ambulances are being held at the hospital?
So we are tracking that better than we've ever tracked it before. We're still averaging about 56 minutes at the hospital from the time we get there. We have seen an increase or decrease in that timing. We are working with the hospitals, our counterparts in Anne Arundel County, and then you'll see some of our other initiatives that were put in place that are going through this. So we continue to work with the healthcare system to make that better.
That sounds like good news.
The hospitals are good. Thanks. All right, on the next page, just more.
How are you tracking the time when our hospital is closed and you have to transport someone to another hospital? Is that included?
That's just included in our hospital wait times. We do a monthly. We look at it monthly. But many times the Anne Arundel is on like reroute, or they can't take a trauma patient, they can't take a cardiac patient, or when it's better for us to go to another facility. Now, sometimes it is better because we can track that for a low priority call. We could take them to Laurel or Bowie, one of those area hospitals or medical facilities, and get our units back quicker than it takes over here. So we work with the system to do it, but we're tracking it. Like I said earlier, the hospitals are working real hard with us. We have people that meet monthly, and they're working it. So we've seen results. We have. So it is getting better.
Great. I do have one other question. It's about the fire loss for 2019. Is that 2.7 million a high number or a low number? Especially given the fact that we're a historical district.
Well, over the last few years, that number is pretty consistent. When you take into consideration a few years ago, like the Yonkers fire was probably a $7 million fire. The 2 million, that includes everything in the city. So it's pretty average. This year's fire loss is already up. You saw that fire we had on West Street where we burned up a lot of cars. Well, that dollar loss adds up very quickly. And we've had several structure fires this year. So it's going to be consistent.
Okay, thank you.
Sure. The next slide's just a few more highlights that we'll just run through real quick. Fire and Explosive Services Unit. I'm sorry. Yeah, this is the turnout times. This is one of our performance objectives that you'll see as we go through it. This is what we gear on or how we determine whether or not we're meeting the national standards or we're doing a good job. And this our average times to get out of the building. At 1:47 seconds is a little high. We're working on that. But it's one of them fine line things that we need to make sure they get out of the building quickly, but they got to do it safely. we can't get out of the building and we can't make it to the call, we can't help anybody. So we would like to reduce our average turnout times, but our response times, that's from the time they exit the building and get on the scene. And in the city of Annapolis, we average a unit on scene in 3 minutes and 9 seconds. So if you add that 2 minute turnout time to it, within 5 minutes, a majority of the time, we're on the scene anywhere in the city of Annapolis. The next one is the ALS service.
Chief, before you move on,
Yes, sir.
I appreciate your desire to improve this, but frankly, I think it's pretty remarkable response time, and has got to be part of the reason why we have our ISO ranking as #1. So, again, happy that you are always in a continuous improvement mode, but this looks pretty good to me. I think Sheila wanted to say something also.
No,
I thought I saw your pen up.
It is very good response times. We're very proud of it. We are meeting the national standards to get on scene. Like the next one there, we have an ALS provider. An ALS provider means paramedic on scene a majority of the time within 4 minutes. And the national goal is to have them there within 8 minutes. So that is excellent. So not only that, we have a unit on scene within that 4 minutes that has an AED and an EMT on the scene for those medical calls. So that it's very good response. And the next one is that.
What does the ALS stand for?
Advanced life support.
Okay,
Basically, they're the paramedics.
Yep.
And the next one
Regrettably
is
familiar
there's
with that.
Yeah, I'm sure you are, sir. We're glad that that worked out well. The next one is the first alarm assignment. There's a goal of having your first alarm on scene within 8 minutes. National standard, that's to have 15 or more people on scene. And in the city of Annapolis, we have at least 15 people on the scene of a structure fire 6 minutes from the time they leave the building. So those averages are good. And like the chair said earlier, that is part of the reason that we maintain that ISO class 1 rating. But we're glad that we're able to do that because we can get to the citizens and our help in relatively quick timing. The next one is just some more highlights. We can just go through them real quick, but you'll see the tactical medic activations. They're the ones that go with the SWAT team, make sure that our police officers are safe, and then any other injury that occurs during those high risk environments there. The safe stations, that is the program that we have where somebody that needs help can come to a fire station or a police station, no questions asked. We will facilitate getting them in contact with mobile crisis. Mobile crisis will come out and try to place them in the need facilities depending on the addiction or the needs that they have. We'll do a medical screening and make sure they don't have to go to the hospital prior, but that's the safe station standards that are out there. I can tell you, because questions come up during the pandemic here, whether we are still doing that. We are. And as long as mobile crisis can continue to come out, we will continue to do it, even if we have to do it with people coming to the station and we talk to mobile crisis on the phone. But we are continuing that program. The program has not stopped. So we're proud that we're able to do that, and we wanted to make sure you all were aware of that. The other ones are just more stats, but the public education events, during our public education events, we've reached over 40,000 people here. Next slide is just that, as most of you are aware, for us, our EMTs and our paramedics, we're under state law, under COMAR, we're required to have a medical director. We operate under this doctor's license. I don't want to say this is a steal, but we are getting a very good bang for our buck here, because Dr. Heller, who's been our medical director for some time now, is a doctor at Anne Arundel Medical Center. He does this for $20,000 a year, which is remarkable. Our surrounding jurisdictions are paying 6 figures plus for their medical directors. So if we ever lose our medical director, we'll be coming to you saying we have to do something different. We work under that doctor's license, and we are able to continue to maintain our status here in the city of Annapolis. And then Dr. Chismar is the medical director for MIMS, with Maryland Institute of Emergency Medical Systems in the state. So we work under that. Our next slides are goals.
Sheila
Chief,
had a question.
before you go on, is there any change to Dr. Heller's status at the medical center now under the pandemic? I know they are repurposing many of the doctors. So I guess I'm asking if his work there is impacting his work with us at this.
His work is not impacting his work with us. We work under him. We work daily, and he's good with. We have a chief in charge of emergency medical services here in the city. That's our EMS safety chief. We have a captain in EMS. So our daily operation, we don't even have to touch base with Dr. Heller. But anytime we have a question or anything needs to be changed, he is there. He's for us, and he gets in there. But he is an ER at the hospital, so he's constantly busy. But I don't think his duties can change because he works in the ER.
Okay, thank you.
Can everybody mute when they're not speaking? We're getting a little bit of feedback.
So if we go to the next slides, it's part of the goals that were requested. We have published goals every year for many years. Chief Spriggs and I, this is our number one goal, will always be our number one goal, and that's to enhance the safety and health of our personnel. It is our goal that everybody goes home at the end of their shift. So we will continue to have that as our number one goal, and the objectives there is to reduce job injuries, make sure we're looking at injuries that occur over and over and see what we can do to ensure that they don't occur. We do that. We have an accident review board. We have good workers' comp people here in the city of Annapolis. We work with risk management. In the past, we've had some back injuries. We've been able to get some different stretchers and some equipment there that have reduced those injuries. So that is our number one goal, and the performance measure is just that. We're going to continue to review the workers' comp claims and the accidents of city vehicles. Our second goal is to provide a safe environment to the community. We're going to do that through our education programs, maintaining our ISO programs, tracking our turnout times, as we talked earlier, tracking our times at the hospital. So there are performance reviews, and we're going to look at their loss due to fires and injuries from the jurisdictions as the benchmarks that we're going to utilize. Third goal is at staffing. This is our minimum staffing. This is very high on our priority list, and that's to get to that minimum staffing, however we can do it, to 25 every day, and that affects the staffing at the Eastport Fire Station and the number of ALS providers we have on board. We have had multiple incidents over the last 4 months because of our staffing levels where it's become a concern to us, and I'm just going to let you know so that you're aware of them. I used the Harbor House fire that occurred the last few months. Because that crew in that station can only get one piece out if that fire is in their first due area, and Harbor House is right behind the Eastport Fire Station, they have to take the pumper to that call because that's got water. They arrived on location of that structure fire, and they had to rescue people from balconies, and that ladder truck sat in that building because they couldn't get it out because we didn't have the staffing levels. So that's just one incident. The fire on Duke of Gloucester Street, the engine company there would be the second due engine. Now, if the fire's on Main Street, the Eastport Station's your primary engine because Main Street's one way coming up. Duke's one way coming down, so the Taylor Avenue Station's your primary engine. So the Duke of Gloucester fire, the second due engine company couldn't get out because they took the ladder truck to that one. And then just within the last few months, and I always get the street wrong, so over here off of Wendell, back in that area there, we ran a structure fire. And because our staffing levels, so our ladder truck was on another call, Chief Spriggs and I actually ran this fire. It was a working fire. Fire was shown from the dwelling when we got there. Our first two ladder trucks were coming from Odington and Wallchapel. So as Alderman Arnett talked about earlier, we have seen a slight uptick in our fires. And this is our staffing levels really being seen here. And this is part of what we lost many years ago. We got some of that back with the SAFER grant. We're just not to the point where we can support it on a daily basis. Also, the ability of having that truck staff there gives us that peak time medic unit that we're always in need of. Because when that truck's in service, that is the crew we use to put that fifth medic unit up. When the hospital wait times or our call volume is extremely high, we switch them over to a medic unit, and we can't do that one. I think. Do you have a question, man?
Chief, I know this is a new process, and I'm very happy with the way it's working as a part of the Finance Committee hearings, but the kinds of verbal information that you were giving us on the performance measures for this first 3 goals would really have been invaluable to have actually included in this presentation. I think that one of the benefits that we hadn't anticipated of these performance measures and these PowerPoints is I think we always have a responsibility to report out to our constituents what we're doing for them in exchange for their tax dollars. And these standards and these PowerPoints are really telling that story. And I don't know whether we can get it for this year, but certainly we need to get sometime reasonably soon, actually all the things you were giving us orally that back up these performance measures. And as you were just doing, it's the perfect opportunity to make the case for why we could improve if we had more staffing. So I appreciate what you're telling us orally. I wish we could actually get it in print and make it operational. But so I just wanted to make that point. Sheila, I think you did also have your hand raised. I'll let the chief respond to me first. But
Yes. Chief, so what is the total number that you would need to adequately fund the staffing that you need?
So
For the latter.
we believe we would need 6 additional firefighters on staff to help us with that. Now, as we go through it and at the end of this, because you all had asked for the enhancements that weren't approved, one of those enhancements is in there. Now, Chief Spriggs and I are very cognizant. We're very proud of our budget, actually, and being able to do what we can with the budget. And I know that it's a $20 million budget, and that's high. It's a lot of money. But as you look at it and as we go through it, you'll see that it's all personnel. So we had asked for an increase, just to increase the overtime to try to staff that unit more so we could get to that point, because we're very cognizant of the stewards of taxpayers' money, and we know it's hard pressed, especially at this time, to say, hey, we need to add people, but that's where we are. And to go to Alderman Arnett, I agree with you. We've done these goals every year. They continually to improve, but it all boils down to what we all know, and that's the money the city of Annapolis has and getting the best bang for a buck. And I can tell you that in the fire department, we definitely try to ride on that, and we do the best we can. But as we go through it, you'll also see that, we try to cut. We came up with we offered up to 50,000 as that was asked for this budget here, but there's really nothing, and you'll see it even more as we go into this, but there's really not a whole lot more we can do with the operating budget. It's all people. So, and here it's hard, but this time of year, I'm telling you, we need a few more people to get to where we need to be, but we're proud of what we can do, and we're going to continue to strive to make it happen.
Thank you for that response. I do, though, I think it benefits everybody. It certainly is very helpful for us, but I think it is even more helpful for the departments where we fill out these performance measures with specifics, and that is the ideal place to make either there or in the benchmarks, make the argument that with more resources we could make additional enhancements. And so I think this is a major improvement that the administration has added in terms of us having accountability. And that's all I would ask is you said it all orally. It would really be nice if we could go back and put it in as bullets under each of these performance measures and the one that's coming up as well. But anyway, I don't want to be unappreciative of what we're seeing now, because this is extremely helpful, and I think it'll be helpful to pass this on to our colleagues when this goes to the council at large to make the ultimate budget decisions. And all of these PowerPoints, I think, will go into our report to the council. But I think that's the next step, is to actually put some real numbers in behind these bullet points.
Okay. We good? We move on?
Please. And Fred, you.
I saw Alderman Payon pop in there. Only thing I see on my screen is the one person that's talking and in the slide. So I just wasn't sure if there was another question.
Nope, not for me.
Okay, thank you. The goal 4 is another important one for us. As you all have heard from me in the past, cancer in the fire service is a terrible thing. We're seeing it more and more. Right after Chief Spriggs and I were promoted to the positions we were in, we lost a young lieutenant who had been battling cancer for some time. We've also had some young members of our department that ended up retiring early on and passed that had died from cancer. So cancer among firefighters is prevalent. We have one that's fighting cancer now that just had treatment. And we have some cancer survivors in the department. So we're doing everything in our power to continue to address this issue. We know that a lot of it has to do with construction of materials. We do everything we can to make it safe. We have protocols in place where they decon their gear every time they come out of a structure fire. We've made some improvements last year. Thank you to the council and the mayor. We were able to get some additional, we had first generation. We've been washing our turnout gear here for years. We were ahead of the curve there. In the current budget, we were able to enhance that and get the newest generation of extractors out there. We can't afford to give every member a second set of turnout gear, but we're working towards that goal. They're Nomex hoods, which is the protective hoods that they wear. We've gone to a particular blocking hood, which is the best out there on the market. What the research has shown is there's particulars in those hoods, if they're not clean, are there, and it goes through your skin, through your neck area there, and can be of an issue. So in the current budget, we also added 10 sets of gear to the supply. And what happens is the turnout gear has to be replaced every 10 years under national standards. So gear that's coming up, if it's 8 years old, we replace that gear, put that gear on the rack. So because we can't afford to get that second set of gear, what happens is after they come out of a structure fire, they go to the Taylor Avenue station to logistics and they get gear off the rack while their gear is being cleaned. So we continue to look at options there. The turnout gear at the Taylor Avenue station is still in the engine room there. There's no partition wall in there. So I know that there was some upgrades that you saw in facilities budget. Part of the upgrades to the fire stations is to put that wall up there to separate it so it's not near the exhaust or other areas like that. But we'll continue to do that, and we're going to continue to watch our cancer rates in the fire service. Yes,
So,
sir.
Chief, again, I don't want to beat a dead horse, but and you and Chief Stokes, your predecessor, made me first aware of all this cancer issue many years ago, and you have done things. There's more to do. But again, if this document becomes making the constituents aware of what we're doing as a city, this is the perfect place to talk about under performance measures, what we've done, but also make the case what still needs to be done. So I just wanted to reemphasize, you're telling us orally exactly the things that I think we really need to see here. And I think they're very important points, and it helps us make our constituents aware of what you're doing, but also what you need and why, when they complain about their taxes, we can make the case, here are the things that you don't really know about that you get day in and day out, and what they go to. And if you want to protect the very people who are protecting you, these are the extra steps we need to take. So I'm not going to ask for a response, but I think these are very good points that we could be making.
Thanks. I think Alderman Payon had a question.
Yeah, Chief, I'm not sure if this is the time to ask this, but I was looking at the budget summary at the end. Do you want me to hold the question, Mr. Chairman, or should I? Are we at that point where
And we're interrupting them enough in their
Okay.
presentation. While we let them finish, and then I did want to go to the budget pages.
Thank you. Go ahead, Chief.
So truly, we only had 7 goals for the year. I haven't gotten through them. I'm sorry. But goal 5, the ALS provider skills enhancement rotation. I talked earlier about how what makes our department so great is that we wear so many different hats. We have people that are cross-trained as paramedics. We have people that are cross-trained as hazmat techs. But our paramedics are on the medic unit every day. And our goal is to have every member of our department succeed in their career. And because we cross-train, we don't have anybody that's just a paramedic. So if a paramedic goes out the door, they're firefighter paramedics. They pull up on a structure fire, they put their turnout gear on, they put an SCBA on, and they go to work. And because of that, sometimes their skills rotation, because they're on the medic unit so much because of our staffing levels for medics, we don't get to do that rotation. So we've identified that we need 12 medics per shift. That's our goal. We continue to work towards that goal. We know it's going to take some time. The department knows it's going to take some time, but we wanted to make sure we could give the opportunity for everybody to succeed and for them to be able to rotate off the medic units. So Chief Spriggs talked to our battalion chiefs. They came up with a program they're trying now, which seems to be working. We're going to have to make some improvements to it. Different agencies do different things, but no matter where we go, we want to continue this enhancement. And that's what this is, just to measure how that's working for us and making sure that all our members are given the tools to succeed in their career. Goal 6 is just the community outreach programs that are out there. We do a lot. We do Stop the Bleed. We do Narcan Leave Behind. It's called Your Life Matters. All that's rolled together. We do CPR skills. We do fire prevention skills. We do some substance abuse. So we want to continue that. We are tracking that more. As you saw when I went through last year's goals about talking how we touched 14,000 people. We think it may have been more. So we're tracking it better. And then we're doing some additional avenues and training to make sure we do some Spanish training, and that all our literature is done that way also. So that's all this goal is. And goal number 7 is, we talked earlier about the hospitals and the medical system all together in the United States. We've been accepted into a trial program, which gives us an optional protocol that we work through the state. And we are looking at avenues on alleviating some of the hospital wait time, some of the overflow at the hospital. So this is just the beginning stages of it. You'll see this over the next few years of how this mobile integrated health program pans out. What we're going to start with is we've got the ability to transport to some alternative care facilities, meaning like right time or patient first for some of our lower priority patients. We're going to be able to do that. Will not affect our EMS billing, but it may also get to the point where we do some, and you're hearing it a lot lately, as we're doing now, everything by teleconference here. We're going to do some telecommunication stuff with doctors where our medics can bring them right up on the iPad with the patient, and they can all talk it out at the scene to see if the patient even needs to go to the hospital. So this is a new program for us. It's early on. We have a partnership with Anne Arundel Medical Center that before this pandemic came was going to start, where they were going to go out. Anne Arundel was actually going to help with providing some of the funding. So some of the people that are using the EMS system on a regular basis that just call an ambulance because they're out of their medication, it was going to partner with somebody from social services and the health department and one of our medics to go out to these high frequency users and see what we can do to help them. So this is a program, and this program will be expanding over a period of time. I'll quickly go because I know you were trying to keep it to 45 minutes, and I know the police are behind us, and we haven't even talked about our budget yet, but our long-term goals, first one on the next page is we have an ISO Class 1 rating. We feel that it's important for us to go back and become an accredited fire department, which is just a different accreditation. A lot of that ties into the ISO rating. Our police department is accredited. Now, what it does for us is it makes us look even harder beyond the ISO Class 1 to see where our department is currently, what we can be doing better, and making sure that we're meeting all those standards. So eventually, in long term, it'll be down the road that we're going to work towards that. We were, commission through the accreditation years ago. Chief Stokes and I totally agreed with it. We felt that the ISO rating gave more bang for the buck for the citizens because it does affect some insurance ratings and how much they're paying for businesses and homes. So we wanted to get that first before we even touched upon this accreditation. But that's just one of our long-term goals.
Chief,
Yes, sir.
our screen didn't show it, but Alderwoman Tierney had a question. I don't know, Ellie, if you still have a question.
I do, but I think he might address it. I didn't realize you had long-term goals, but I'll ask anyways because it's really important. I'm looking at last year's goals just to see how we were doing and tracking. And there was a goal of mental health and suicide of first responders. And I just want to check in on the status of that goal. And I also want to add that looking at last year's budget, not budget, but the performance matrix, this is the most statistics that we have received from the fire department that I can remember in the last 2 years. So I commend them on that. Thanks.
Okay. So if you go to long-term goal number 2.
Oh.
I think that'll answer your question.
It wasn't a softball question.
We know that this is going to take some time. What we have done is we have, it's in our contract services, we have a mental health professional that we have on contract that works with us. He works with our peer support and our crisis team, our internal teams. They provided some workshops to all our personnel on mental health. They want to continue that and to move that forward. So it's just a long-term goal. But nationally, in the fire service, in public safety, police and fire, we've seen an uptick in suicides. And we want to make sure that the mental health is taken care of. We've actually had some members here that have utilized the program very well. The International Association of Firefighters has a facility right here in Prince George's County that is set up for firefighters that are in need. And we've been able to utilize that also. So that continues to be a long-term goal. We're continuing to move that forward, and that's high on our list. I think that answered your question. Long-term goal 3, we sort of touched about it. Okay, thanks. Long-term goal 3, we touched about it on the short-term goals, and that's just to continue to build upon that mobile integrated health program that I just talked about. And the last long-term goal, which is always on the minds of our staff and us, is just the upgrades to the fire stations. So that's goal number 4. As you know, the Eastport Fire Station was on capital project list years and years ago. There were actually plans drawn. They were going to build a new firehouse. We understand the way economy went. That got pushed aside, actually was taken off of the goals, the long-term capital projects. And we are continuing to enhance that building room by room, basically. You know, the female facilities there were absolutely terrible for the females in our department. That process has just about being done. The sprinkler system is going to be put in the building. They've made some improvements there. Unfortunately, as of yesterday, we have some plumbing improvements that went along with the new addition that we're working on, but we're continuing to enhance the fire stations to make them better for the people that are living there for 24 hours a day. The female facilities were one of the big ones. So Taylor Avenue is taken care of, Eastport's taken care of. The problem at Eastport now is the men's room in the back, some of the pipes in the floor and all, and that's all part of what you saw yesterday with Public Works for some enhancements to the station. So it's on their list. They've made improvements. We talked about the volunteers earlier. It's a city-owned building. The city's putting money in the building, but as for those of you that have been at some of the meetings in the Eastport meeting room or the community hall there, the volunteers actually use some community funds too to make that room nicer. And I think that the improvements over there are nice, and they continue to use this for the community, the hall over there, that you'll see a benefit of that. The Forest Drive station, the female facilities here are basically in poor condition too, but that project, it's in the capital project listing. I think it's still a year out, but it's tied to the capital project for the maintenance facility for Public Works. because all that was going to be done when maintenance moves out of the building here. That can free up some space to make some improvements at the station. So that's just one of our long-term goals. So now what you all are here for and you've been waiting for on the next one, here's our budget comparison.
Chief, before you go on,
Yes,
can you
ma'am.
hear me?
Yes, ma'am.
Under your capital list that you just referenced, does it include the storage building behind the Eastport station and the drainage problem and the roof problem over there?
So
Is that on your list?
that is part of what Facilities for Public Works is looking at. I can tell you that yesterday they were working on the drainage issue at the Eastport station. So it is on the list, and Facilities for Public Works is working hard to make those improvements.
Thank you.
Okay.
Thank you for remembering that, Sheila. It is an ongoing problem.
Mm-hmm. Thanks, Chief.
So I'm that common sense fire chief, and I try to keep this simple. So I think that I've broken this down pretty good, and we'll go through it. But if I could, we have a $20 million budget. 18.6 million is salaries, benefits, and overtime. So that left us a $2.2 million operating budget. Of that operating budget, there were items on there that we have no control over and can't touch, and that would be electricity, which is at 98,000, and fleet maintenance. Now, if you remember, Teresa and Jody were very big on making the budget realistic and capturing the costs. So what they've done with this budget, and they started it last year, is that fleet maintenance is being charged to each department for what it's costing. So while it looks like a big increase this year, it's putting the money where they're saying it's coming out of. So this includes fleet maintenance of all our apparatus. It includes fuel. It also includes part of the salaries for the mechanic to work on. So that's fleet maintenance. So if you take fleet maintenance and the electricity out, and then you'll see that there is a $900,000 capital outlay item in here, and that's to replace the SCBA, and I'll talk about that in a few minutes. But if we take all that out, there's $650,000 to operate the 3 fire stations for the entire year.
What's the 954, the capital outlay?
So $900,000 of that capital outlay is for self-contained breathing apparatus, and I'll go through that as we get farther. Or we can talk about it now if you want.
Whether gas.
Yeah. Well, our SCBA is at the 2007 standard. There's been 2 safety upgrades and standards since then. So our SCBA, our self-contained breathing apparatus, which is the lifeline for firefighters and paramedics to go into structure fires, to hazmat situations, has basically reached its lifetime expectancy. Our bottles, the air bottles that are on there, we've seen over the last year or two that 50 to 60 of them have been condemned. They're not meeting the hydrostatic testing. There are 2 safety standards out of review. So we needed to get it on there because the SCBA needs to be replaced. And the mayor was able to put it in its budget. It's a one-time cost. The actual pricing that we had was higher than the $900,000, but we believe that we can do this for the $900,000, hopefully a little cheaper. But what that does is that replaces all the SCBA in the department. So that gives us, it's more than 75 harnesses, 200 bottles. So there's bottles are different. There's 45-minute bottles, there's 60-minute bottles, and the hazmat team needs a 60-minute bottle. So that's all involved. And each individual person gets their own face piece. We do not share face pieces. And as this pandemic's gone, you understand why. But each one has to be fit tested, so they get their own face piece. So everybody's got to have their own piece. There's RIP bags involved. There's thermal imaging cameras involved. So it's a big project. It is, but it is a necessary project. It's a safety thing. It goes towards our #1 goal, and that's what's in the capital outlay. But because it was a one-time purchase, it was decided when they were going through the budget process with finance and the city manager to put it in the capital outlay, not as a capital improvement budget, because it's a one-time expense and it'll be taken care of.
How many do we get for $900,000?
So
and is it possible to spread this out over 2 years?
75 full units. And I was asked about that. I was asked if we could spread it out over 2 years. The problem is we're looking at a different manufacturer and air mask, and I have concerns about 2 different types of air masks being out in the field at the same time. They take different faces. They're doing a study now through multiple people in our department. We have people at the training academy, so they're getting to use structure fires. So they're trying MSA, they're trying the Scots, they're trying the different manufacturers that are out there. But I don't know that the current manufacturer is going to be the one that's going to be picked. And I also don't know what bid they're going to come in as. So that's my only concern about doing it over 2 years. What I can tell you is that we are looking at all types of aspects of trying to fund this. So if we can find an alternative funding source, we will, and hopefully save the city some money. But at the present time, we just don't have it. We don't have the grants. We're applying, but we're not sure where it's going to go with it because it's a big expense.
Right. Chief, looking at the budget summary that we have in our books, the difference in contractual services from 2019 till this fiscal year, it's a huge increase. It's about 3.5 times higher now than it was. Who are we contracting? What is that about?
We did not have a radio contract. So our radios, we did not have a contract. So every time a radio broke, we were being charged fees for that. You remember over the last few years, you put money in the budget to enhance the entire city radio system. With that, we had to get a radio contract in our department, and that goes up every year. But that you'll see a difference between last year and this year on that. The exhaust system, which is part of the initiative.
Can I break in here?
Yes, sir.
First of all, I think, Julian, you need to flip us to the next page on the PowerPoint. But Fred, I don't see, I'm looking at contract services. I don't see a tripling of that.
Page 103.
Pardon?
Page 103.
So I don't understand. On this PowerPoint slide, contract services was 138,900, and now it shows 150.
Well, contract services 304,595 in 2019 and 738,370, or excuse me, 994,200 for 21. I'm reading right from the book.
I'm trying to square the differences between the PowerPoint slide and the page that we have in the budget book.
Also, I can clarify that for you.
Okay.
Well, I thought you can.
So we lump multiple accounts in contractual services. So what you see in front of you here, rents and leases, contractual services, postage, telephone, all that is in contractual services in the budget book. Supplies through dues and memberships is included in supplies and other in the budget book.
Okay.
Thanks, Katie. I was just getting ready to
Can
say the same thing.
Can I also add to that, please?
Yes, please.
Yes, so Alderman Payon, what you're seeing there in that trend where 19 had $304,000 in contractual services and it's tripled to 994, most of that is the vehicle charges coming from fleet operations, which Chief O'Malley spoke about earlier, in that we used to have that on a separate line item in the finance budget, and we've now over 2 years moved the whole thing up into the departments. So everybody's department on repair and maintenance vehicles will show a significant increase for those 2 years.
So thank you for that, Jody. And it would be, Chief, when you were talking about some of the detail in the capital outlays, the respirators and that sort of thing, would really be good to have that kind of detail so we understand and we're able to answer for ourselves the very questions that Fred was astutely asking. I don't know whether that's detail we'll get when we get the line item budgets information, but if not, if we can get it from you, Chief, to fill out this page 103 of the budget book, that would be very informative. And again, information I think that our constituents need to be aware of.
All right.
Yeah.
If I could go just a little bit farther, Mr. Chair. Do we ever buy equipment like this, like and I'm going to call them gas masks. I realize it's not exactly what they are, but that's a common term. Can we buy those with the county and get a better deal? So if we buy them at the same time, buy them as a unit, do we ever look into doing that sort of thing?
So we always look at state contracts and who else is buying at the time. The county is on a different cycle than us, and we're getting 10 years out of our bottles. They replaced theirs within the last 5 years. So their system, they replaced theirs. It was a lot more than ours because they had to buy a lot more. So we look at it and we look at getting the best prices around, and so does purchasing to assure that we can get them for the prices, that the best prices out there and what we need.
All right. And one further follow-up, I think it's my last question, but don't quote me on that. How does our budget, the total amount, the $20,899,000, how does that compare per capita with the county budget? Frankly, I think we have better coverage than they do. I well understand that, but do you have any sort of per capita comparison?
I would have to ask finance that. I do not, but I can tell you that while the county has good response areas or time in some areas, I don't think they can compete to our response time because of our 7 square miles and how we have our stations.
I agree, and I love the service we get. I don't compare the two, believe me. I just was curious from a strictly financial standpoint. They have almost 600,000 people. I'd be interested to see what their budget is compared to ours. But thank you, Chief.
Sure. And just to get back to your question about contract services, the reason you're seeing that is exactly what they're telling you. They just lumped a lot of the stuff into one area and called it contract services now. But we have it broken line items, and there is no significant increase in any of the lines that we have. But the contracts for the services we have, like our stretchers and our cardiac monitors, the vehicle exhaust systems in the station and the radio contracts, they increase every year. But having these contracts is saving us a lot of money.
Okay. Please understand, I don't necessarily object to it. I just wanted to know what it's a huge increase from what it was 2 years ago. Not so much from last year. Well, actually, it's pretty substantial from last year too. But as long as you have a good explanation, that's fine with me. Thank you.
I did not take any offense to it, sir. I just know it is. Thanks.
May I ask Jody if it's possible to add a notation on these budget sheets that these items, such as contractual services, and for you, Chief, capital outlay, have other items lumped within? Because I think that's part of our confusion. I was going to ask the question about the capital outlay that's on the budget sheet compared to what you've given us. And it started with the 56,000 and went up to 956,000. Now you've explained that to us verbally, but there's no place that says those are for your breathing apparatus, which is a necessity. I think that's a note that should be somewhere in your documentation, and maybe it should come from Jody, your department, since you know where you've lumped various items.
Okay, so the line item you see there, capital outlay, won't look any different in your line item detail because there's only one account in our system for capital outlay. That includes all such capital type purchases such as the self-contained breathing apparatus and other capital items that they'll buy. And so, yes, we can give you a breakout of what they've requested, and so can Chief Romali. They are the ones who gave us the number and what's in there. So 900 of the 956 is for the self-contained breathing apparatus. The other 56,000 is for other items, and we can get you a list of what they've requested that for.
And I don't want a minute details of that, but what I think
it's a good question. There's a lot of mixed things in there because it's kind of a catch-all account for all capital type items.
Okay, and like I said, he's explained the breathing apparatus for 900,000. That's an easy one, for us to remember, I think, or make notes on our sheets. But under the item that Fred was questioning, where it's tripled over 2 years, it may deserve a breakdown as to what things are included in that.
So on that item, the contractual services, the line item detail will give you a breakdown of which accounts are in there. And as you will see, the one that's showing the increase is the fact that we are now charging the vehicle operations charges to each department. And for them, that's a considerable number since they have such very large equipment being charged to them. So that's a significant amount for that contractual services line.
And you've talked about that on the various departments, but I just think it would be helpful to have a note at the bottom of these sheets that reminds us of that. That's all. And especially when it's a big number.
Sheila, I think it needs to be more than a note. This is exactly the kind of detail that we used to get that we're not getting now. And I can foresee when this goes to the council at large, we're going to get these same kinds of questions from Rob or Dewan, and it is important information. And so I don't care whether we get it from finance or fire, either is fine, but I think we need to have all of that detail. It needs to become part of the budget book, and it certainly needs to be part of our report from the finance committee to the council so that they don't have to do this kind of digging and try to figure out what's going on. So I think this really isn't a note. I think it has to be the detail that we display. That what this display strikes me as what would be in the appropriation budget. That's fine, but that's not the kind of detail we want in the line item budget. That's what allows us to understand what each of the departments are doing. We need to understand what they're doing because we need to explain them to our constituents and more importantly to ourselves as we're making policy decisions. So I think that we do need that kind of detail.
Alderman Arnett, can I interject with a question?
Certainly.
Thank you. On the vehicle line item, I know this is a crazy question because I know last year we asked it to be allocated to the respective departments, but Jody and David, do we have a summary of that cost in total so we know, so we're tracking it from year to year? It just seems like it's a big chunk of money that affects the respective departments, and now it's kind of lost in the respective departments. So I just want to make sure that we're tracking this vehicle line item.
There is all of those amounts that you see are originally from Danny Horwath and the Fleet Management Division. And he's the one who comes up with the estimates of how much it cost him to repair and maintain and provide fuel for each piece of equipment. And we have a schedule that shows the different sizes of equipment, different types of equipment, and how much we're charging per month and annually for those pieces of equipment.
Okay.
There's a detailed list that supports that.
Okay.
If I could just add, it's a best practice across fleet maintenance to have them as an internal support fund where they provide service and then the customers actually pay for it. So think of a rental car company of how they charge them. That's how fleet maintenance should be operated. And that's how it is now operated in the city is the money goes to the customers then pay for service, both as an operating fund, but also as a replacement fund because those vehicles all have to be replaced at some point in time. So we should be gathering enough money to cover the operations, but also start establishing funds to replace the vehicles when they're going to need to be replaced. And that's the way we're doing it. And so you're seeing these bigger costs in the departments now that should have been there all along. And I think we're budgeting it properly now, but it's a change from the way it was done previously.
Okay, as long as it works for you, that's great. My last question, and you probably know where I'm headed on this, with the masks, is there any relationship that we could make with COVID, so that, we could pursue some grant funding for that. I don't know if there's any relationship with COVID-19, but just to research any sort of grant opportunity.
The only one may be if the number of calls that fire is responding to because of COVID, perhaps we could try to capture that and ask for that from FEMA as part of our additional costs. I'm not sure. Chief could respond to that. But otherwise, I'm not sure how we would do that.
So emergency management will be tracking all our calls related to COVID, and they're going to do like they do every time for any other natural storm we have. They're going to have us calculate everything. They're going to submit what they can that the federal government will allow, and then that money will come back to the city, or 75% of it. But as for offsetting some of the costs for these normal operations, I don't know that that'll be there.
Okay, thank you.
So you were asked, can we go back to the other slide, the one before this? I know that you're looking at, I guess, page 103 where it's lumped everything together, but this is basically the line item budget that I think you're looking for, and you can see the differences between that we put in there for the proposed for 20s and 21's budget. So the first one's salaries. There's people get step increases, there's pay increases there. So the top 4 lines there are all part of that cost and benefit, they're salaries and benefits and overtime. So that's there. That's the differences in pay there. The employees' physicals are part of that benefits part that's broken down in the salary and benefits. The NFPA standard is that firefighters are supposed to get physicals once a year. We have not had enough money in there to do that, so we've done it by age. So depending on your age is whether you get it once a year, once every 2 years, or once every 3 years. However, you've been able to slightly increase that every year for us. So we're just about to the point where we're going to meet that national standard. So that's where the physicals are, but that's required. However, we are going to be looking to try to do some additional cancer screening in that. The electricity is just that's that line item. Now that does look like an increase. It's actually a decrease from the previous year because we were averaging $90-some thousand a year anyway in electricity. They were hoping through the Honeywell project, all that of it would go down. So in the current budget, they had cut it back a little bit, and I don't think we necessarily met where it was. So Jody and looked at what the electricity is, what that difference is there. Repair and maintenance of the buildings, there's no increase. That's $1,500. Just $1,500 for our station officers to do minor repairs that they don't have to get facilities in here to do. So that's all that is. Repair and maintenance of equipment, that is not for the apparatus, that's for fire hose, that's for anything else that breaks within the department that we have to fix. So it's sort of different than supplies, but it all relates to the supplies budget. And then the next item down is what we've all been discussing, big increase, and is where facilities is fleet services that's where their money's coming from to do it. So if we go to the next page.
Chief, before you go, may I ask a question about salaries?
Sure. We'll see if I can answer compared to
salary line reduced by 44,000. What's that accountable for?
That's an increase. Those on the right side, that's an increase. The only ones that are decreased are the ones with the minuses. So the 44,000 increase, like I said, there's been step increases throughout this year. Plus, I would imagine that the pay raise, however that's built in there, I know we're in negotiations currently, but the pay raise would be part of that increase. And Jody can explain more.
No, I understand. I just misread it. These numbers are kind of small, so. But I'm good. Thank you.
All right, next page. Rents and leases, you'll see there's no increase there. That $15,000 in rents and leases is basically the agreement we have with the Core Volunteer Fire Company. They had bought some equipment, some fire apparatus, the medic units. Their medic unit we staff every day, and we use that as a primary unit. The agreement is that we will provide with $15,000 a year just to help them maintain that. The equipment they buy, they make yearly payments on the equipment until it's paid off, and that's just a little help for them. Contract services, I think this is more in line with what Alderman Payon was looking at. If you look at our actual contract services in the department where I was talking about our contracts for the radio system and stuff like that, there's only a $11,000 increase from where we were. And that's because of the increase in the fire protection engineer and the services for the radio contract, and the other contracts we have on our cardiac monitors and stuff. Postage, we just need a little money postage because postage is going up. Telephones are there. We have an agreement with the hospitals where they actually bought the modems for our cardiac monitors, but we have to pick up the service in this year's contract for the cell service for it. It saved us a lot of money. It's just, that's an agreement we had. So that's a little bit of the increase there. We were able to consolidate some of our phones. We went to some different plans in there. So that has helped us throughout the years, but we continue units. And with that, you have to have air card. It comes to $50 a month, basically. So that's what's there. Salaries are flat. Supplies are flat. That is any supply out there. We need an appliance for fire apparatus, EMS supply, gloves, the stuff we're going through with COVID. That all comes out of that. That's only $200,000. The copier cost is a slight increase there. They're on contract, and I guess the contract went up. The personal protective clothing or the clothing account, slight increase there. That's basically inflation. As we replace our turnout gear, our bulletproof vest, they have to be replaced. Turnout gear is replaced every 10 years. The vest is replaced every 5 years. All that comes out of the account there. Training and education, that's where we made up the amount that was asked for in the budget for the deficit, and you'll see that's down 45 compared to what we requested. That will affect the number of paramedics we get trained. However, we think we can maintain our operations with the amount that's in there. We'd like it to be higher. We want our people to go out and do some outside training. We've got all sorts of outside training requirements, but we believe that we can maintain the next budget with that deal there. And then dues and memberships are for the multiple different, their NFPA, International Association of Fire Chiefs. There's a there. And then the capital outlay we already went through with the SCBA. Does anybody have any questions? I think that's with the line items that you were looking for. And ours is broken down by line item, and then we can tell you which line items fall into the salaries, benefits, contract services, and supplies, if that helps with what you were asking.
That does answer our questions, but I would say to the city manager and to finance director, we really do need this kind of detail. I know it's promised that it's coming, but it helps so much to hear it from you, Chief Romali, and it makes our budget decisions much easier to make. And I think having it is going to head off a lot of repeating all of this over again when this goes in front of the council for the consideration of the whole council. So whether we get the kind of detail you just gave us from you or elsewhere, I do think we need it. And I certainly want to make it part of the Finance Committee report to the council and really think it should be part of the budget.
Okay. Anybody else have any questions on the budget part of it? All right, real quick, I'll run through the enhancements because we were asked to give you what we had sent down. There are not a lot of them, but there's probably 5 of them, and we can just go over them real quick. So on the next slide, the first enhancement, we've talked about it already. That was to help us with the minimum staffing getting to 25. We felt that if we increase the overtime budget to do that, that doesn't necessarily come with a bunch of new people and the other costs that are associated with new people on board, healthcare, other items like that. So we don't know that amount would totally get us to the 25 every day, 365 days a year. But we were looking at alternative ways to come in and say, hey, we believe we can at least help it this way compared to saying, okay, we need 6 new firefighters, which will cost us close to $600 with benefits and salaries. So that was just a way Chief Spriggs and I thought we might be able to get to why it's still it's the top number one enhancement order of where we stand, and that's our highest priority there. The next enhancement is it's true and dear to me. I'm sorry, did somebody have a question on the other one?
No, but Chief, I would urge, because we're way over time, we go through these relatively quickly. It's not that we don't care about them, and we did ask about them, but unless we're going to find cuts elsewhere, I mean, it's very clear for this year's budget, we're not going to be able to accommodate these things. So we wanted to know what we're foregoing, because once again, we need to answer to our constituents about the level of the budget. I just had a long conversation with somebody this morning about how we're increasing our spending so much every year. And the fact of the matter is, if we wanted to do things better than we are now, not that we're doing things well, we could spend even more than we are. This budget is a very conservative, constrained budget. And, you know, we do want to hear what we're foregoing, but I'm not sure we're going to be able to do anything about it.
I understand. It has to see where we put them. So the next one is the only one that I really want to talk about. You can read through the other ones. This one here is dear to my heart. I really believe City of Annapolis, and I'm looking at some other ways to try to help fund this position, but I believe we need a fire engineer on staff to assist with all the concerns that are always brought up. I know Alderwoman Tierney has the sprinkler ordinance that was, we always get talked about how to utilize the second and third floors of Main Street. We have a fire protection engineer now that's just contract for us. We are getting multiple services out of him he doesn't charge us for. I just don't know how long he's going to be with us. But I also, and I know you all hear it as the older people, that when you go out, sometimes you get stuff from the public about how sometimes it's difficult to work through the permitting process. I just truly believe the fire protection engineer on staff benefit not only us, but zoning with the permit process. That this person, this certified engineer that has a vast knowledge of all this experience, not only with fire protection, but as an engineer, that during the plans review process and the questions that arise, and especially with our historic, this dates back to the first time where they put that fire committee together after the first Main Street fire in the 90s, that thought that we should have a fire protection engineer on staff. We've done third party. That has cost a lot of money, not only to the city, but to the people out there building, doing construction, because the costs were so high trying to do third party fire protection. And I just truly believe that eliminate a whole lot of issues in that process, concerns, and some of the appeals that are personal and staff. And I'll continue to look at ways to make it happen. But this one is true to my heart, and I citywide, this position would help.
Chief, may I ask, would you keep the current engineer that we're paying an hourly rate in addition to this full-time position?
No, this would be a full-time position, full-time staff for the city of Annapolis work here. You know, if he's there every day of the week instead of only coming in to do plans reviews part-time and charging us for the plans reviews he's doing so they can answer questions when people come to the permit. We truly believe that the person, but it would not be both. No, we would be.
So what would the savings be on the part-time person?
So we have $30-some thousand already set aside for this position in contract services. It's just a matter of how we the difference the other way, and some of the funding comes back because it's charged during the permit for their fees. So we do recuperate. Planning and zoning would have to tell you how much we bring in for those fees. it's not a warrant, because there's many times where we get a permit in, as they start talking to people, that can't do it, so there's no related to it. And some of these are city projects too. You know, we still got to charge him. We get charged his service, but it's a city project, so we can't charge it back to the city permits. It just,
So
I truly believe it would be beneficial with the permit, the one-stop shop that we keep talking about here. I just think it would improve all around. That's just my view.
So the total cost might not be the 97,000, maybe less.
No, it would not, it would take the money out of contract services, so we're down to the 60,000.
Yeah.
Yes, it would be less.
Okay, thank you.
Can I just interject real quickly? As you know, we're involved in the sprinkler legislation, which, by the way, we're going to postpone until we have a better environment to introduce it. But just this engineer, what we have to realize is that we have a lot of retrofit projects, and NFPA has different guidelines and recommendations for those retrofit projects. It's specific to the historic structure. So this is something that we only have, on call right now, and this position would be very beneficial. I understand, though, it does add money, and we'll have to find it somewhere else. Thank you.
All right. Well, we've gone way over our allotted time, but fire is certainly one of the important and bigger parts of our budget. Notes that I have to myself are to ask you, Chief, for some of the elaboration on the performance measures that you gave us orally. And also we need to get from somewhere, and I'm fine getting it from you, more of the detail that's on the budget page 103 that summarizes some of the things about the masks and all of those other things, both in contract services and in supplies. Are there any other questions from the committee?
I have one question. Chief, did you only have 2 enhancements?
No.
If you have our PowerPoint, there's some other enhancements on the back, but it was, and one of them, and I didn't even bring it up because we were trying to get through it, but one of them has to do with, we're very proud about our diversity in the department, but we don't have the money for the testing. And I know there's HR able to give a written test, but to do the physical agility, the interview process, that money is funded. And for us to continue to have a list with a diverse applicants, the only way to do that is to fund the hiring process, at least to get it. So that is one of the other ones. And you can, if you have any questions about the other ones, just let me know. But there's a couple of them about equipment, but we basically discussed everything.
Right.
Okay.
So,
I wasn't sure you had finished with your presentation.
well, I was trying to hurry it along. The enhancement number 3 on cancer remakes that very important point, but we have police waiting in the wings, and we're clearly going to run over time for this meeting. I don't think it's unwarranted, because this is, as I said, an important part of the budget and an important part of services that we deliver and our citizens expect that we deliver to them. But I think we need to wrap up if we can. Fred, did you have any questions? I can't tell whether Fred's on mute.
Oops,
Yeah.
I'm muted, sorry. No, I'm good.
All right. Sheila, any closing comments or questions?
No, I would yield my time to the chief to give his closing remarks.
I think that's a good idea, but first I think we should all thank him for the effort that went into this presentation and the information that he gave us. Fire is always at the top of the list in the city in terms of helping us understand and do our job. So we always appreciate that.
So I appreciate your time, consideration in the budget. Earlier before the presentation, making out during this pandemic. We do have the Buys currently maintain us through the next two. What I can tell you is I'm still proud on the way we manage that currently everything we've gotten increased amount of issues we're running into the pandemic, we're doing it within our budget and the donations that OEM is giving. So we're continuing to look at that. It's not going to stop anytime soon, unfortunately. We want to make sure our people are well prepared with proper PPE as they go in and they transport these people to the hospitals. We've had several people in quarantine. I don't know if you're aware of that or not, but all of our personnel have tested negative up to this point. And we continue to make sure that we're doing all the guidelines we have set forth with all our protocols as it comes to running these calls. And I'd just like to give Chief Spriggs a second to see if there's anything he wanted to say, because he's been sitting through this the whole time in another room, so I haven't even got any eyes from him to see what he's had to say about our presentation. Thank you, though.
So I would just echo what the fire chief mentioned. We are very proud of the personnel that we have working for us. And then one other thing that we're very proud of, the chief had on one of the slides, and I know we don't like to mention or we don't like to say it out loud, but the city of Annapolis has had 0 fire deaths since 2010. And I attribute that to the great work that our people have done with fire prevention and the reaching out to the public. And then our firefighters and paramedics actually going in and doing the job and serving the community. So that's something to be very proud of. And it's not something that's very light. It's not taken very lightly by the fire chief or myself. So we're very proud of that. And we look forward to any support that you all give us.
Thank you, Chief Spriggs. Without further ado, I think we need to move right into police.
Am I audible to all?
Yes, you are.
It was my hope to jump right into the budget by sharing my screen. Is everyone able to see what I'm showing on my screen?
Nope.
No, great.
I see you.
Chief Herman, are
It's
you
a
able
start.
to send that
What
to?
a disappointment.
Are you able to send that to me?
No, I'm not.
Okay.
How about now? No?
Yes.
There you
You're
go.
able to see my screen?
Yes.
Yep.
Okay, very good. And you're still able to see me?
No?
No, just the screen. Okay, perfect. So I don't need to be self-conscious. All right, very good. What I wanted to do is jump right into our staffing and our budget. As everybody I'm sure knows, we're a CALEA certified.
Excuse me, Chief
organization.
Herman, you will be
Yes.
seen on the broadcast, just not on the screen.
Oh, very good. Thank you for the
You're welcome.
the warning. We are a CALEA certified police organization. That's a very prestigious certification. Not a lot of organizations do have it. We just got a recertification this year. It's similar to the fire equivalent that Chief O'Malley was referring to earlier. We have 124 authorized sworn positions. 112 of those positions are currently filled. And what I wanted to do is go down and make special mention of a couple of the positions. For example, I think everybody's aware recently we had a crime analyst. We hired a crime analyst. It was a funded position at the time. That person will be dedicated to do intelligence information, crime statistics, reporting out to the city council, to the mayor's office, and other such. That was a critical part. The other thing that we did recently was the forensic supervisor. This is a position that we were hoping to fund this year in our budget, and I'll get to the line item in a moment. The forensic supervisor, we have a forensics unit. I'm sure many of you are aware. They respond 24/7 to all major crimes, shootings, homicides, even burglaries, that kind of thing. That person is responsible for collecting, organizing, and analyzing all of the forensics that are gotten from the crime scene. That is not currently a filled position. It is our hope to fund the position. That's in the process right now. That's in the current budget in front of me. The next position I wanted to mention very quickly was the cold case investigator. We just recently filled that, and that's in our budget. We've brought on staff a retired colonel from Baltimore Police, and that person will be going through all the old, primarily homicides, but also non-homicides, some robberies, shootings, that kind of thing, going back over old information, recontacting all the victims, the witnesses, and queuing back up cases to the state's attorney's office if appropriate, if there are developments. One of the enhancements that I'll discuss in a moment is camera monitor. We currently have one camera monitor. As everybody's aware, throughout the entire city, there's a rather comprehensive network of cameras in all public spaces and some private spaces in the city hall and so forth. We only have one camera monitor to monitor the entire array of cameras. As you can imagine, we can't guarantee that everything's under being monitored. So one of our hopes in an enhancement was to add another camera monitor. And then finally, the only other one I wanted to describe was the our project manager for I'll get to in a moment why we had to pull it, but we did have an IT project manager which was funded up until very recently, and we had to pull it this year in the interest of fiscal responsibility. So the bottom line for our purposes here is, as you can see, we've been able to hold our staffing despite our request, our desire to enhance our staffing. We've been able to hold it steady at 174 funded positions. I did want to tie everything as was requested. I wanted to tie everything to, and I want to make sure everybody can see this. This actually is publicly available. It's currently on the city's website, and it's open for the public to see, obviously. This is a summary, the high-ordered summary of our strategic plan going into the next year and the following years. I can send the link to everybody. It's actually not in our submission that we made to the council. And I'm not going to read it to you, but at a higher level, it has all of the goals and then the objectives of the entire department, and every one of our budgetary line items is linked to one of these goals and objectives. Furthermore, not only do we have that publicly available to the public, but we also this is not publicly available, but I'd be happy to make it available to any member of the council. This takes the goals and objectives and further reduces it into tasks. So each one of the goals and each one of the objectives is further subdivided into a task that's assigned to a particular person. There's another part that I wouldn't want, just because it's far too detailed and I think anybody would care to know, but there's another part of this report, of this plan, that further reduces timelines and schedules when this assigned person is responsible for delivering that task in furtherance of that objective, in furtherance of that goal. And all of this is currently being implemented now as I speak. So I wanted to go back through not working. There we go. What we did for the purposes of the budget, and I just wanted to make sure that there's no confusion, is we summarized our goals and objectives in the format you're seeing right now, just for the purposes of simplicity and clarity.
Major, did we get a copy of this?
Yeah, it's on page 43 of the budget book.
Okay. Thank you.
If you recall, I couldn't find it either the first night we got these. when I called you. Starting on 43.
There's several page 43s. Let's see.
Page 53 is police performance measure. Top.
Well, let me interject right now. David has informed me that we really have a hard stop at 1 o'clock. I guess I want to apologize that we didn't make our guidance from the Finance Committee clear enough, but I was hoping to get from police presentations like we'd gotten from the other departments to date that were couched in terms of these performance measures and then led to discussion of the budget like we just had with fire, getting into the budget tables and getting into some of the detail of categories that have been concatenated, like contract services and supplies and those sorts of things. And I'm wondering if we gave you more time, Deputy Chief, if that's something that we could get at a subsequent meeting of the Finance Committee.
Looks like we've lost him.
Yeah,
I can certainly
he's
work with
popping on
them
now.
to get it in the format that we were looking for based on the template that we now have from the Public Works presentation. And I think the fire presentation went very well in the format that they used. They took the Public Works format and customized it for their purpose, and I thought that was well done. But I'll certainly work with police to get this in the right format.
I got to tell you, Dave, that I mean, I could be here till 4 o'clock with questions based on what we have in front. This is not satisfactory. I mean,
well,
anything satisfactory, but
let me break in.
There ought to be a lot more information here, and I'll attribute it to neither one of the two fellows at the top have presented before to us. Thank you.
Time out. This is a new process. It's formative. I think we ourselves on the committee are learning. I think we lucked into, first of all, the presentation from Public Works. I'm so happy they went in first, but also when we talked about this together, this notion of following the performance measures, brand new, they're still formative. I think it's a new process. I don't want to castigate anybody. I just think that we now have higher expectations. No. And I know Deputy Chief Herman is more than capable of helping us with a reformatting of their presentation. It just was very hard to follow, jumping in and getting into specific items in their staffing summary and those sorts of things. So, but we need to give people slack. This is brand new to every department, everybody in the city, and we're going to have to be flexible as we work through. But David, I definitely appreciate your offer to work with him, and I would hope you would alert all the other departments that our expectation levels have been very much raised, and we appreciate all the efforts they're doing, and we know it's hard times for everybody in general, and certainly hard times when we're in a crush to do budget. I do think it's effort worth taking, because to the extent we can get this right, and I'd like to include the PowerPoints in our report to the council, I think it's going to shortcut a lot of questions when we get on the council floor. So I think it's an effort very much worth making. And so I would appreciate if we could re-coordinate with the police down the road. We'll have to find the time, but do that.
I agree with everything you said.
I concur. I have a question. Are our colleagues all getting budget books?
Are who getting budget books?
The rest of the council. Does everybody get a budget book?
Everybody has budget.
Yeah.
Okay, because I was thinking we could put their presentations, the department's presentations in their budget books. So they'd have it.
That's exactly what I'm doing, Sheila, and I think you're absolutely right. That's why I just think this whole new tangent is so good, and I hope we continue it and pass it on to our successors on the council. It's making, I think these budget presentations are so much better than we've had in the past, and it's making it so much easier to zero in on the important issues. I think we're giving the department heads the opportunity to make their case, and I think in turn, this gives us an opportunity to make their case to our constituents. So I just think it's a very good thing, but we have to be patient. It's a new thing, and we'll have to work through it.
Okay, so I'm good. So are we going to reschedule police for at the end?
I'd like to leave that up to David to work with police and figure out what works for them, and then we'll have to figure out how we squeeze it into the schedule. I'm feeling, and I want to check this out with you committee members, because we're getting these good PowerPoint presentations, it's going to make doing our report to the council much easier. I'm thinking we do a preface piece, including the guideline, and then include the PowerPoint presentations from all the departments, and then we'll get into our discussion for things like the capital improvement fund and so forth when we get to that. But I'm almost feeling that the report is being written for us in large measure by each of the departments.
Well, I'm looking at the schedule, and we do have time on Tuesday, the 21st. We have a 2-hour meeting planned and only one presentation, and that's planning and zoning.
Which will be a big one.
Yes, so we could actually put police there.
Okay.
Still have to put finance in, but I think we decided to put finance when we had time, since finance is in the room with us
Right.
all the time.
Except we have to put this out as a public notice. Isn't that right, Takia?
Yes, that's correct. That's what I was gonna ask, if you could do a meeting sometime next week and add them on, because I'll be posting the meetings this Friday, well, tomorrow.
So I'm looking at the 21st.
I have that for police, for finance.
Well, that's not where we put finance. We said
I
we
know,
would put.
I'm saying, can you put them on a meeting for next week? Because I'm gonna post the meetings tomorrow. And that way the public will know when finance will be presenting, as opposed to them just popping on and presenting.
Jody had her hand up.
Yeah, I really need to, one, give me the most time possible, because if you want me to create a PowerPoint based on these expectations that we saw on Tuesday, I'm going to need some time to do that. And then I don't know when I'm going to go, so if you try to squeeze me in somewhere, I won't be ready. So.
Yeah, no, I think that's right. It's fair. We can perhaps, I can work this out with David after the meeting and coordinate with you and Fred, Sheila. I agree Takia needs to know this as soon as possible because it has to be promulgated publicly, but I'm not sure we can handle it in the 12 minutes we have left right now.
Yeah, just a thought for me. So on Tuesday the 21st, we could probably do both planning and zoning and police. The afternoon of Wednesday the 22nd, we've got 2 hours set aside for community grants. That's a lot of time for community grants. Maybe you could do both police and police and community grants on that day in the afternoon.
Or finance that day.
Yeah, if Jody needs more time.
Or finance, that's what I meant, yeah, because we're talking about police on the 21st with planning and zoning, and then finance with community grants.
Yeah.
Which would be a good combination.
Okay. All right, does that help, Takia?
Yes, and also, you know, you're scheduled until 1, not 12. Today.
I don't know what they want.
Yeah.
Yes.
Oh, scheduled to go to 1 o'clock. Yeah, well,
Yes.
well, let's see. That's right. What did your text to me say, David?
1 o'clock.
Okay.
Hard stop at 1 o'clock.
All right. Well, unless we're going to start doing some tap dancing, what else do we have left for this meeting?
Does Paul want to say anything more?
Well, actually, I'm kind of curious when I dropped out.
Oh, you missed a lot.
Yeah.
I see. Okay.
Yeah, that 20% reduction in your budget, you didn't hear that?
Apparently not.
I didn't hear him object to it.
Yeah, right.
Yeah, right. True. Paul, what we were saying is that we'd really like for police to regroup, follow more the template that fire and public works and the other departments have used, which is starting off following the guidelines that are in the performance measures and responding to how you are actually measuring up in the performance standards that you set. And again, Public Works is a good document to look at. And then we wanted to get into some of the things you started to give us, but I have to admit were somewhat disjoint for me, where you started going in and talking about specific things in the staffing summary. And usually with the departments, we've been concluding by trying to get detailed information out of the general budget summary. And then I know the city manager's uncomfortable about this, but we have been listening to the enhancements that were requested but are not going to be granted, mainly for our own edification, but also because we do hear complaints about the amount of money the city's spending, and it is helpful to say, you should see the amount we really should be spending if we were going to do a higher quality, not that we don't have high quality services now, but we could do even better with more money. So we are exercising constraints. The departments this year are being asked to make cutbacks. And so, you know, and I related, I don't know if you're on, but I had a half-hour berating this morning from a constituent about how our spending keeps going up and they're not seeing anything from it, and yada, yada, yada. And I think they're wrong, but we have to make that case to our constituents. So that's.
Well, could I ask, was it helpful to, what I was attempting to do was point out that where there are any increases in line items, why those exist. Is that a helpful approach, or is it better to start with the?
No, it's a very helpful approach. It's just what we've gotten used to, and what we asked in the guidance is to start off by following the performance measures. That helps us get an understanding of all the things the department is doing, all the priorities. It helps us understand how you're meeting your own established performance measures. Then we got into the, for the last presentation from fire, we got into the 22 through 25 priorities. And then we got into the detail on the budget page and got into some of the sub-detail that isn't shown on the budget page for breakouts of contract services and supplies, which includes training and paper and a whole bunch of stuff. And fire pointed out to us that they made a major cut in their training, $25,000 cut in training. That's a sacrifice they're making to help us meet a balanced budget. We need to know that. And so those are the kinds of details that we got into. So we were asking the city manager, I think, is going to be talking to you about a recrafting of the presentation. And then we want to include that. We'd like to get it ahead of time, but we want to include that in our report to the council because I think that's going to shortcut them having to ask a lot of the same questions that we're asking. So they can just go to the PowerPoint presentation and see a lot of that laid out for them. Doesn't mean they won't ask those questions anyway, but they don't have to if they look at the Finance Committee report. Sheila?
Mr. Chair, I'd like to make note that under the police department's budget on page 99, this is the contract services is outlined as exactly what that includes. Unlike in fire, when it just said contract services, here it explains what all of those included in contract services are.
Yeah, and that's a good thing. And it would be very easy since it already exists to just drop it into the PowerPoint presentation.
Right.
Yeah, no, that was very helpful to have that in the budget, and I think it is a model for all the other departments in their budget. All right. Where are we, committee, in terms of proceeding?
Well, we don't have anyone else scheduled for today.
No. I mean, let's talk for a second about the report, though. Do you agree with my sense that dropping these PowerPoints into our report to our colleagues is a good thing to do to help them get the level of understanding we're getting?
I think it would be helpful to put it in their books. I'm not sure we need to put it in the report itself, but I think it should definitely be in their books.
Either or both, yeah. But I think it definitely is very helpful.
Yeah. Do we want to talk as a committee about what we've heard thus far with the departments so far? I mean, we can start our deliberations on, you know, a few departments anyway, if we want. Or we can just go to lunch.
But not together.
But not together.
Well, we can have it together, it would just be virtually. I mean, you know.
I mean, my preference would be to get all the information and then summarize it when we're doing our deliberations on what we report back to the council in our report. But you know, it's a committee. It's not a dictatorship. I'm open to anything.
Oh, I thought this was a dictatorship. I mean, really? You know, well, you know, there's an awful lot of people on this. I'm looking at everybody who's here, and everybody doesn't need to be here. We're just going to chat, you know. I hate to hold them up when they have work to do other than us.
And I feel I don't want to just do make work chit chat. If we can adjourn and have another hour for preparation for the work session this afternoon at 3, that would be fine by me. I also have a roof I need to repair.
Please don't fall.
I'm going to do my best.
I'm good with cutting it right here and running.
Yeah.
Cut and run.
All
May
right.
I ask, David, is there something we should be preparing for this afternoon?
No, there's going to be a discussion on the meetings legislation that Alderman Savage has proposed, and then Sally's going to provide an update on the comp plan process.
Okay.
So it's just those 2 items.
Okay.
All right. I'll accept the motion.
I move that we adjourn.
I second that emotion.
All in favor signify by saying aye.
Aye.
Aye. Thank you, committee.
Thank you, everybody.